Systemic Candida is a very difficult and challenging issue to resolve. As the name implies, the infectious agent is systemic and it is all over the body. Now, Candida is one of these organisms that is in our body throughout our life. There is really no way to get rid of all of it. You can only control how much prominence it rises, and that depends on your immune system. In other words, the Candida bugs are always there. If your immune system is strong, it will be kept at bay. If your immune system is weak, it will come on. Now, if you are weak constitutionally and you have had systemic Candida for a long time, then the goal should really not be about wiping out the Candida, but learning to live with Candida well. And there are many ways you can do. One of the most common clinical mistake is that people try to basically eradicate Candida, thinking that that will be a process that will lead to total recovery. The reality is that while this may be able to happen with some success in younger people who are strong, if you try to eradicate the systemic Candida with strong antibiotics or even natural compounds that have anti-yeast effect, you can cause and generate retoxification as well as die-off reactions that can be very problematic for the rest of the body. So understanding Candida infections and how you can deal with it is a very important part of recognizing this problem. In the case of adrenal fatigue, in advanced cases where the body is weak, it's uncommon not to have Candida that comes up from time to time. Learning how to put this back down in terms of its toxic load and not insulting the body is very important, because in the process, if you're not careful, the amount of damage that you can do to the body actually far outweighs the potential benefit. Many people crash as a result of an overly aggressive Candida treatment. And you don't want that to happen to you if you are in the advanced stages of adrenal fatigue. So understanding how Candida plays into the adrenal fatigue picture is very important. Do not be overly concerned and being misled into the single focus of dealing with Candida, thinking that it will solve all your problems. In the case of adrenal fatigue, you have to deal with the stress, the underlying problems, the dyslipidemias, the metabolic issues that may be concurrent, in order to have a body that is strong. And when the body is strong, the Candida will be kept at bay, and that should be the much better long-term approach. Now, short-term approach, if you are young and you are strong, you can hit and with aggressive antibiotics, and sometimes you can have some good results. But oftentimes, over time, and I'm talking about over the next 10, 20 years or so, or even longer, as the body decompensates, if the root problem is not resolved, then the Candida can return. So do pay very, very special attention to this problem and work on the adrenals, and that is the ultimate solution to control and keeping the Candida at bay. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.